Well, let's talk about the title, Terry. The title is Turf Toe. Oh, no.
Oh, boy.
Because Bengal fans, like any sports fan, rely on their stars to perform. And when there are injuries to any body part, the fans have to say, what is it and what can be done for it?
Joe Burrow has a grade 3 injury. Okay, so that's where it gets a bit more
interesting.
Is that
as high as it gets?
It's as high as it gets. It's as bad as it gets. It's as complicated as it gets. It's as unpredictable as it gets. Classically, and the name turf toe arose from this injury associated in athletes who were playing on what we referred to at that time as astroturf. It wasn't uncommon for an athlete's foot to get stuck, get caught in that shallow, hard turf, and they would hyperextend, or you would see the toe come up quite significantly as the toe got caught, the heel would rise, and that hyperextension force would generate an injury to that plantar plate or that capsule of the great toe.
So think of a pitcher who has to throw 97 miles an hour. Oh, I feel good, I'm throwing the ball. Well, yeah, you're throwing the ball with a radar gun 50 miles an hour, Safit. You usually throw in the mid-90s. Well, yeah, but Doc, I don't have any strength yet. So when we're looking at what we're asking him to do, he explained the difference between movement to prevent stiffness and, kind of cobwebs,
right,
but also protecting against what's called weight bearing to let those hammock tissues heal if they've been repaired.
So it's a more uncommon injury in that capacity, but there's plenty of literature out there that can predict return to play timeline and the likelihood that somebody like Joe Burrow is going to be getting back out there. But I can tell you that they will be very methodical about the stakes. They will have data on Joe, what his strength is like, what his explosives and what his stability. They'll be able to compare that to any discomfort or pain that he's having. So as they are navigating Joe's return to play, trust me, it will be very methodical.
Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Dr. Urse, we came into this podcast today because I call it a 911 podcast. Tell us a little bit about who this guy is and why it's important we're talking about this topic today.
Well, let's talk about the title, Terry. The title is Turf Toe. Oh, no.
Oh, boy.
Because Bengal fans, like any sports fan, rely on their stars to perform. And when there are injuries to any body part, the fans have to say, what is it and what can be done for it? So to help us understand the topic, we have a fellowship-trained foot and ankle specialist, Safit Hadic, DO. His undergraduate training is at St. Louis University. He has a master's in microbiology from the University of Kansas. Go Jayhawks. He's also got medical school training at Ohio University and a foot and ankle fellowship training after an orthopedic surgery residency in Dayton, in Columbus. So we're really pleased with not only having him here, but the qualifications to tell us about why these toe injuries are bad, because the star quarterback for the Bengals has been hurt. And those overseas listeners, this is in the National Football League, one of our star quarterbacks, and we'll let Dr. Hadic tell us what happened and what we can do about it.
Yeah, so you have all that fanciness behind your title. What we normal people want to know is, are we doomed for this season?
He's going to be out for a while.
Oh, God.
Now, obviously, I can only speak to what I can gather from the media and the popular press in terms of the severity of his injury. And I think first and foremost, I've been asked about turf toe more this week than I have in probably collectively the last decade of my practice.
Right.
As a fellowship-trained orthopedic surgeon that focuses on the foot and ankle, there is a component of selection bias. In other words, I'm going to see these injuries by virtue of my specialty and what I do. And the good news is this. Most of the time when I'm sitting down with an athlete or an individual who sustained an injury to their big toe or their great toe, it's a grade 1 or grade 2 injury, and we can talk a little bit more about that classification scheme. It's relevant because, as you have well heard, Joe Burrow has a grade 3 injury. Okay, so that's where it gets a bit more interesting.
Is that as high as it gets?
It's as high as it gets. It's as bad as it gets. It's as complicated as it gets. It's as unpredictable as it gets.
And it usually leads to what?
It can lead to arthritis. It can lead to instability, which can then lead to arthritis, pain, and stiffness. And in the case of a professional quarterback, none of those scenarios would really be advantageous as you consider his capacity to get back and lead a team to the Super Bowl.
But the news today in the United States is Joe Burrow's having surgery tomorrow in Alabama. So that means this severity of the injury is not just potentially problems down the road, but short term, it's not just put it in a boot, let it rehab, quiet everything down. This is, you're going to have to fix some things that get injured. We're going to talk about what things might need to be fixed and why, because how they support the foot when we put our weight down on the forefoot, and we'll leave that up to Dr. Hadic.
So when we started, we were down here talking. I had a lot of questions. Boy, I had a lot of questions about this. I asked, what is turf toe and how does it happen? And you did a fantastic demonstration of how it does.
Turf toe.
Well, let's show these folks
Sure.
one of our props.
Turf toe, very simply, is an injury to the capsule of the great toe, so of our big toe. And
the
I think
capsule's like a lining, right?
the
It's
capsule
like
is what stabilizes this joint. And there's some really unique anatomic features of this capsule, including a couple of bones that we refer to as the sesamoids. I like to lovingly refer to the sesamoids of the great toe like the kneecap of the big toe.
Galen, in Greek days, called it the soles of the body are in the sesamoids. So these are small little bones in little things called tendons.
They're
in
small,
that little hammock underneath that joint.
they're
that
small little
support it.
bones that help support, stabilize that joint, and also provide the immense amount of power and push off and explosive strength that we generate in that joint. So a turf toe injury, quite simply, is an injury that you sustain to that component of the capsule.
And what happens to the toe when that happens?
So classically, and the name turf toe arose from this injury associated in athletes who were playing on what we referred to at that time as AstroTurf. The early generation of artificial turf was essentially green carpet. It was very rigid. It had very shallow fibers. And because of how rigid it wasn't uncommon for an athlete's foot to get stuck, get caught in that shallow, hard turf, and they would hyperextend, or you would see the toe come up quite significantly as the toe got caught, the heel would rise, and that hyperextension force would generate an injury to that plantar plate or that capsule of the great toe.
So you were showing me earlier, like with your own foot, right? You're showing me how your shoe was bent and your ankle was up, and you think that's how it happened.
The heel comes up forcefully, and as the heel is coming up, the toe is hyperextended.
So it's pushed back.
Yeah,
and
so
that
your
is the
toenail comes up toward you. I mean, that's what hyperextension is. And it can also happen if you happen to step on someone else's shoe, and then you like you see it in basketball, and there are sports that this is more common, right?
The mechanism is always the same. There are variations. Sometimes a player can land on the back of someone's plantar flex foot where their heel is up in the air and their toe is kind of bent. That force can create it. Again, the turf toe name comes from that original description of the injury on artificial turf. We have strategies now in professional athletes where we try to mitigate that with various types of shoe gear modifications. We have safer artificial turf surfaces, but this can happen in grass. It can happen to an average Joe, if you will, in a non-athletic sense. So the name turf toe gets broadly applied and is a broad description of any injury to the capsule of the great toe. Okay. And again, there can be subtleties to that injury, and they can be quite severe. The good news is for most people, not Joe Burrow, but for most people, these are non-operative injuries. Okay. Grade 1 and grade 2 injuries, the traditional classification that we utilize and apply to this injury is a 1, 2, and 3 of severity, with 3 being the most severe and complicated injury,
right,
with grade 1 being the most mild of injuries. A grade 1 sprain, if you will, is just a stretch. Okay, you've tweaked that capsule a bit. You're going to have some swelling. You're going to have some pain.
How do you know how severe it is? What tests help the doctor make that decision?
It's a great question. First and foremost, it's someone complaining of pain, swelling, pain. The mechanism makes sense. I'm always a foot and ankle specialist or orthopedic surgeon is going to start with a weight-bearing set of x-rays.
Yeah, because those little bones can actually break, right?
Those
you can have a sesamoid fracture. Like
that's correct.
When you say weight bearing, you mean you're having me stand on it?
I'm having you stand on that if you can, if that's optimal and appropriate. I want to see what that joint is doing under load.
Got it.
I'm looking for bony relationships between the toe and the first metatarsal, or the bigger bone in the medial part of your foot. I'm looking at those little two bones, those sesamoids, because the relationship of those sesamoids to the joint are going to give me some information about the continuity or any underlying injury to the capsule or the soft tissue around that joint. A grade 1 injury, quite frankly, the x-rays are going to look normal. I may see some soft tissue swelling, but that young athlete or individual can expect to probably be back in a couple of weeks. They may not miss any play.
Is that a stove toe where you you kick?
You might otherwise refer to that as a stove toe. That could be a mechanism with which you could experience that type of an injury.
Is that because you kicked the stove when you were younger? That's how they got the name?
Are you going to get an MRI on that person that you just saw?
To me,
or maybe not at the beginning.
Not typically at the beginning.
But maybe an athlete who's going to return to play. Need to know, can he return to play? How bad is the injury? Maybe you get a little more aggressive.
The exam
in season, right?
The exam is really critical. The history is always, again, this has a very classic mechanism, but the history is the most important thing. Now, interestingly, as a subspecialist in foot and ankle, and the challenge with some of these injuries, turf toe injuries in general, they can present to me rather chronically. So it's not like Joe Burrow, where we know when it happened, we watch the video,
right,
it's less than a few days away. This is something they've been struggling with, great toe pain, the better part of the season. Maybe it started last season. So I'm coming in, and that's where imaging may change my understanding there. I may be looking for early development of arthritis because they're, again, developing problems down the road. But the majority of grade 1 injuries, there's going to be a fairly expeditious return to play within 1 to 2 weeks after some, mild, rest and recovery. Shoe gear modifications traditionally will stiffen up the shoe.
Yeah.
Your physician may recommend a turf toe liner, which amounts to some type of carbon fiber or stainless steel shank that you put in the shoe or the cleat to stiffen it up, just so the big toe doesn't have to work quite as hard.
So out of 100 of these, how many are Sev 1, Sev 2, and Sev 3?
The majority are going to be grade 1 or grade 2.
Okay.
And again, that diagnosis is typically generated from a clinical exam. We may see mild instability. We may see injuries that are just dragging on a little bit longer. So a grade 2 injury is a stretch or partial tear, partial injury to that capsule.
Right.
Okay. Sometimes there can be some associated injury to the sesamoids, but again, when you have a more complex injury, you either have a full thickness tear of the capsule, you have instability in the joint, or you have a frank injury, fracture, or broken sesamoid. That escalates it to a grade 3.
Yeah, I tell people that the capsule is kind of like a hammock underneath those two bones of the big toe knuckle. The biggest knuckle you feel in your big toe has this sling or thickening, but it's much thicker than a hammock. But when that isn't there to support, or it gets stretched or torn, then that's where problems occur. We also did a podcast on pickleball, which is a common sport that a lot of people are playing, but they don't maybe spend enough thought process into getting the right shoes or the right inserts for shoes. So again, you're on a harder surface. That's where a lot of things probably in prevention mode would help prevent some of these injuries. Because I think we see, that a lot of these other sports the racket sports, some of the harder outdoor surface sports, and certainly football and basketball are, and soccer around the world would be a common place you'd see these.
And it's important to differentiate, again, in my position, particularly in an individual who has more chronic pain, you need to differentiate an actual capsular tear or turf toe injury versus sesamoiditis or inflammation or just an irritated sesamoid, which can happen as well. So this is not, it's this or this. It can there are a multitude of different things that can generate pain in the great toe. But ultimately, recognizing a turf toe is really important. And unfortunately for Joe Burrow, he had a grade 3 injury. Now, what I can't tell you is, having not looked at his X-rays or reviewed his MRI, which I can tell you he had, because as a physician, you're trying to assess, is surgery going to be necessary to repair that capsule, repair that sesamoid, stabilize the toe to improve the likelihood that, in case of Joe Burrow, he's going to get back to doing what he does professionally, which is leading, offensive line for the Cincinnati Bengals. So what we know is, from the popular press, he has a grade 3 injury. So it's the worst of the worst, okay?
The worst.
It's the worst of the worst. But again, early diagnosis, early treatment, rapid evaluation with weight-bearing X-rays inevitably, and an MRI. The MRI is a test that can really answer a lot of questions as it relates to what in the capsule exactly has been injured, how much of it is torn, is there any associated injury to the tendons and or the bones, those sesamoid bones, which are really important there for the function of the great toe. So if Dr. Urse just shared with me that it's reported he's scheduled to have surgery tomorrow, provided that the swelling in his big toe is amenable to that. In other words, it's diminished enough that they can safely make incisions on his big toe to fix the appropriate structures. But either way, even with a ready, readily getting to surgery, he has a long road to recovery.
See, that's the news.
And this is over this is 3 months minimum. So I think in the just what is going to happen now, you can say that. I also wanted to add that when we're trying to figure out what to do, X-rays show bones really well. It does show what are called soft tissues, which are the muscles and things around it in general, but not unless they have calcium or something in them. When we get more detailed imaging, like CAT scans, we see the bone and the joints better. But for us to see the soft tissues, which are the lining, the capsule, he talked about these ropey things called tendons around the joint. The MRI is like taking a can of vegetable soup and going right through it and saying carrot, celery, piece of ham, whatever you're seeing, you see every layer, and you can go from top to bottom or on the toe from outside to inside. We see medial to lateral, but we see the joint in like a picture in different views, and it gives us the information of where's the damage, what has been injured, and what can he do or any regenerative surgeon do to put things back so that they heal in the optimum position to hope recovery becomes full.
The goal, and not unique to Joe Burrow, but the goal of surgery for a grade 3 injury or grade 3 turf toe is really to facilitate repairing that torn tissue, addressing any associated pathology within the sesamoid bones. If you have an associated break in one of those bones, you need to address that as well, because your goal is to facilitate stability of that joint such that after you get the incisions healed, which is going to be a priority, and that's why they're really making sure that Joe's swelling is ready, that his toe is ready for surgery. They need to get the incisions healed so that they can get that toe moving in a predictable and controlled way. So you can imagine that somebody like Joe Burrow, but really anybody, is going to have a very methodical post-operative rehab course. He'll be off of it initially, but they will very readily, within the first couple of weeks, work to start getting that toe moving, because a joint wants early motion. You need stability to facilitate early motion. But having said that, he may not be doing any straight line running for, it could be up to a few months. Now, again, there's a lot of speculation on my part because I don't know exactly what they're going to do there. But in general, this recovery can be upwards of 3 to 4 months before they may let him practice. It could be longer before he's ready for competition. And again, you have to keep in mind what they're preparing him to get back out and do.
So how many?
Think of a pitcher who has to throw 97 miles an hour. Oh, I feel good. I'm throwing the ball. Well, yeah, you're throwing the ball with a radar gun, 50 miles an hour, Safit. You usually throw in the mid-90s. Well, yeah, but Doc, I don't have any strength yet. So when we're looking at what we're asking him to do, he explained the difference between movement to prevent stiffness and, kind of cobwebs,
right,
but also protecting against what's called weight bearing to let those hammock tissues heal if they've been repaired. So I think that's where the expertise of the surgeon and the protocol after the surgery comes in based on what they had to do to fix the problem.
So how many toe experts? You're a toe expert, and the guy down in Cincinnati you were talking about earlier is a toe guy. How many toe guys are there around?
Well, say foot and ankle specialists.
Well, somebody who at your level who could
because he
do a
does
Joe
certainly
Burrow.
more than. So in fact, we're going to ask him to come back and talk about ankle replacements, which is a great option for what we used to do to stiffen it. Yeah, we did replace knees and shoulders and hips. Well, now ankle replacements are back on the forefront because the design's better. The people doing them are able to do them properly and get great results. But they were not good historically. That's another podcast. It's a great option, but a fellowship-trained foot and ankle specialist is really working from the knee down to the toes.
But are there
not just the toe?
Are there two of you around here? Are there 2,500 of you guys? How many would you say are at the level of the guy in your level?
Well, I'm not going to speculate the level. I mean, I can tell you that Joe is going to be seeing, the very best, and there are a few of us here in the greater Dayton area. There are more to our south here in Cincinnati. I knew within a matter of, I watched the injury as everybody did on Sunday afternoon, and once it kind of was a little bit more clearly elucidated the nature of the injury that he had, I knew within a matter of minutes who he was going to be seeing conceptually, who might be looking at those x-rays. So, again, in the care of the professional athlete, even within my small community of fellowship-trained orthopedic foot and ankle surgeons, we kind of know where these cases are going to be heading.
And the agents are the ones that send them there. They're the ones who are... The
agents are working to coordinate it.
I mean, I hate to say it this way, I don't get in trouble with that. But the bottom line is, if you're taking care of, someone famous like Troy Aikman, who was a quarterback in the past, and he's got a bad knee injury, you're going to go, Troy, you're going to the best guy I can think of who does that knee surgery. And no matter what the team doc was for your team,
really,
I want you to go see Dr. Jones.
So
Dr.
the agent
Schmo.
takes care of that.
But interestingly,
they guide it. I'm not going to say they make the final decision, but they say, look, I've had 5 other guys like you with that injury, and Dr. X here had them all back on the field. And he's the guy or the girl.
And keep in mind, with this particular injury, the turf toe injury, the majority of these are navigated even by surgeons with my experience non-operatively. So it's only a small subset of these injuries, those very severe grade 3 injuries in a high-level athlete or a demanding individual, not necessarily a pro athlete, who warrant surgical intervention. So, even a busy fellowship-trained orthopedic foot and ankle surgeon isn't going to be doing these every week. So it's a more uncommon injury in that capacity. But there's plenty of literature out there that can predict return to play timeline and the likelihood that somebody like Joe Burrow is going to be getting back out there. I mean, they've looked at subsets of professional athletes in NFL, NBA, and there's a very good likelihood that Joe is going to get back to his pre-injury form, having had surgery and having this addressed. So,
but it's not this season.
Yeah, fans need to know the body has tremendous healing capabilities, but we can't hurry those. We can't make the sands in the hourglass fall faster for your team's hero. It has to be.
There's roughly a 17% risk of re-injury. Again, guys like Dr. Anderson, who elucidated the classification scheme that we all use for this injury and you all have heard about this week, those guys have looked at their experience. They've looked at the data. There's about a 17% risk of re-injury. So it's really important. Obviously, they're going to do a great job when they address this surgically. we don't want Joe to get hurt again.
Sure.
Yeah.
Right.
The answer is to live to play another day.
Absolutely.
And if you said, is this season going to be tough on his average touchdowns per season list? Absolutely, right? He's going to miss 3 months minimum. So you have to also realize that
it's late September. If they make if Browning can take us, all the way, there's always a chance. But I can tell you that they will be very methodical about the stakes. They will have data on Joe, what his strength is like, what his explosives, and what his stability. They'll be able to compare that to any discomfort or pain that he's having. So as they are navigating Joe's return to play, trust me, it will be very methodical. Resources well beyond what I have as a community orthopedic surgeon, but nevertheless, it's going to be no less methodical.
And just to have you recall, we did a foot and ankle kind of Big Ten of common foot and ankle problems. Nate Melton, one of our colleagues, one of our partners, is a fellowship trained foot and ankle specialist also at our group. So oadoctors.com has a website that people can see. Our group has 2 fellowship trained foot and ankle specialists.
We have 2
in the whole state. There's probably a couple handfuls, but maybe more.
Okay,
but it's not an overly sought after fellowship by most residency standards. I think everybody looks at sports and total joints and hand and shoulder, and again, foot and ankle is a common problem, and there's plenty of work for people with his expertise for this.
Foot and ankle is a great subspecialty. I'll digress for a moment. Obviously, I'm biased, but I get to be a reconstructive specialist. I get to do arthroplasty and joint replacement, and I get to be a high-level sports surgeon. So the scope of my practice is pretty broad, and honestly, that's largely what attracted me to it. There aren't, again, as Dr. Urse alluded to, there aren't that many of us, particularly locally. We have 2 of the 3 very capable orthopedic foot and ankle fellowship trained surgeons in the Dayton area. And again, we've got some great surgeons. And the great thing about the community is it's a very small community. We all pretty much know each other. In fact, our National Academy meeting was just last week. So, I probably sat down with his surgeon at some point in time over the course of that week. So
wow.
It's a small community, and again, you can assure Joe's going to be getting the very best care. But it's no different than the care that any of us in the community would extend to our patients. It's a challenging injury. I've gotten more questions about turf toe. It is not simply a stub toe. With a grade 3 injury, it's not something you can just stick it in a boot, let it heal for a couple weeks, and you're back at it.
Yeah.
It's a significant injury that the downside is you can have chronic instability, which can lead to early arthritis and stiffness. And whether you're a professional athlete or not, that can be a challenging thing to even navigate your activities of daily living, let alone play pickleball or throw a football with your kids in the backyard. So it is a significant injury, and it needs to be addressed methodically.
So one question I have for you, for the normal folks out there listening, like me, how would I know I need to come in and see you? Right? Well,
I was just about to say, let's talk about what happens when you have that injury on the court. When we see somebody and they say, I got hurt playing this sport, whether it's their child or them, I always ask a few things. Were you able to continue to play? Oh, no, they carried me off. Well, that's usually a more serious injury. Oh, I played 5 more games and then it was really sore.
Yeah.
Not a horrible thing usually. But either way, you want to say, what am I going to do initially? Well, I'm going to arrest it. I'm going to get off it, hopefully. Ice it, elevate it, maybe a little compression, and see how I do. I mean, most things, are going to tell you this is way more painful than I expected and something's wrong. And you're going to seek care for it. I mean, in simple terms, an x-ray is a great start. I mean, something as simple as a small sesamoid fracture could hurt like the dickens and be a nothing to take care of in the long run if it heals, but you wouldn't know it without an x-ray. So you want to see how your injury is, see what you can do in the short term. We talk about elevating and icing and getting off it.
Yeah, but my first call is to my general practitioner. I
Well,
walk in to see Dr.
It could be, but
Smith.
we have a walk-in orthopedic clinic.
Would I?
You would be able to
or
walk in.
Would I go to Dr. Smith and say...
You could go to an emergency room, but your family doctor may not have X-ray. He
Right.
may not have expertise in.
But what would they do for me?
injuries.
What would
Well, they would
what
refer you to
they
Dr. Hadic or me.
But would they run any kind of tests on me?
Well, they
to say-
might. They may have
What would
X-ray.
they
and
do?
they would probably do baseline X-rays if they have X-ray
Okay.
capability. They would start you with some anti-inflammatory medication or something for pain.
So they wouldn't wiggle it or anything like that?
Well, I don't think they want to mess around with things till they know what's wrong. We
They,
don't
they
always,
may. Ideally, they do an exam
Yeah,
because
okay.
you can
We like
learn
that.
a lot. You can learn a lot from an exam. It would be very typical that they might get an X-ray because in the differential considerations, you worry about a broken toe, broken foot. Obviously, turf toes in our differential. It may not be on every physician's consideration.
Well, I guess what's the difference between a broken toe and turf toe? It felt like it was broken, wouldn't it?
So it's
Well,
very
let's
much
show 'em.
it's
Let's
very much going
do
to
it.
feel like it's broken. But
Show 'em one of those toe bones.
But a fractured toe
Sounds like a song.
is an injury to one or more of the phalanges of the toe versus a metatarsal fracture, which are these longer bones in the toe. So again, a turf toe, a grade 3 turf toe, can include some type of a broken bone, classically an injury to the sesamoids, which we talked about, those smaller bones. But a fractured toe is going to have a much different long-term outcome and short-term needs than an injury to this capsule, which is going to impact the stability of that toe.
Yeah, you may be walking to the bathroom in the middle of the night and hit your toe on
I've
a
done
piece
it.
of furniture,
Yeah.
and that'll break your toe. Well, that's going to heal with a little firm-soled shoe and
Heal
tape
rather
it.
expeditions in most
Yeah.
individuals.
This-
By
this
6
other
weeks, they're
injury-
back to life.
Yeah, they tell me. I've heard the rumor. You guys tell me if it's true. You got a broken toe, nothing they can do.
Well, it depends, obviously, whether the break is into the joint, whether that could lead to arthritis. Where's the fracture? Is it out of place? Is it he talked about those long bones called the metatarsals. Some of them are very bad actors that can't heal very well because the blood supply is poor. So there are things you would want to seek care for if a short-term improvement isn't being seen. You want to know what's wrong.
So bruising, swelling, pain, difficulty bearing weight.
For how long? Does it matter how long? If it starts to fade after 2 days?
Well,
or
if it depends, and again, it's all in the context of the mechanism.
If you don't know what's wrong, you can't Google it, right? So you really want to get a diagnosis. That's what we think is important in medicine. So what are you going to look
Now,
up? My foot
interestingly,
hurts?
we live in a world where people take pictures of their feet and they upload it into a large language model and ask, "Hey, what's wrong with my foot?" So interestingly, they've looked at the sensitivity and specificity of some of these large language AI models,
Yeah.
and they're not too bad. So maybe we need to start counseling people. Just take a picture of your foot and upload it to ChatGPT. But nevertheless, if you're in doubt, pain, swelling, bruising, difficulty bearing weight, you had an injury that you were not able to weight bear on immediately, that probably warrants, number one, a clinical exam. Very likely we will start with x-rays, either non-weight bearing or weight bearing, ideally, and then manage it from there. And as Dr. Urse alluded to, oftentimes, and particularly with grade 1 and grade 2 turf toe injuries, as we talked about, you're going to start with RICE. So it's rest, ice, compression, and elevation. Everyone's favorite
Love
acronym.
acronyms.
He does
Love
love
For
acronyms.
doubt, remember, on the big toe. So I want to thank our sponsors. This is something we really appreciate. We
Absolutely.
have tedsaladressing.com. It's a Greek salad dressing.
We need to bring
Some
jars to give out to
a
guests.
marinade. Yeah, we're going to give those to probably our guests someday. And then we also want to thank GWR Group. They're a financial group with
Yep.
Guy Brad and Jeff Richardson. The Stiefel Group's really helpful for people that want some financial guidance. Their websites will be posted behind us on the screen. But we appreciate our sponsors. We want people to also like the Bone and Joint Playbook and get whatever social media platform you use to encourage more people to hear about turf toe so you can talk at the next poker match with your friends intelligently.
I can never talk intelligently with my friends. That's not saying anything about me. It's more about them.
But I think we've covered, like, how does this happen? What can we do? What's the rehab and the treatment plan? So
Right.
turf toe is like a lot of things in medicine. You try and find what it is, find the right person to take care of it, whether it's you or your doctor or healthcare provider, and then find out what can I do to recover from it and not re-injure it. We're going to do a talk in the future on some of the hamstring and calf muscle tears. And those are really good topics for not getting back too soon to get a re-injury. And Dr. Hadic talked about, why it's important to protect the repair on a turf toe patient so it has adequate time to heal completely.
So do you want to do anything, mention about OA, about anything? Because it sounds like you guys are the premier group in the area for orthopedics.
I will tell you, if you want to see Dr. Hadic, you can go to oadoctors.com and find his name, my name, our office locations, which are in Southwest Ohio in 9 different locations.
How many doctors total, you think?
22, probably, but
All right.
I'm probably missing one. Don't make me name them. But I mean, we have a lot of extenders, physician extenders. We have physician assistants and PAs.
We have a comprehensive team. We kind of got you covered head to toe. We have a huge geographic footprint. So we have a team down in Hamilton, and we reach as north as Sydney, Ohio, northwest to Greenville, and then over to Springfield. So we've got you covered in the greater Dayton area. And again, whether it's your foot and ankle, Dr. Melton and myself, we have an excellent team, and obviously happy to tackle those tough problems with you.
Yeah, and when you get a problem that's more serious, they're going to get referred to Dr. Hadic or Dr. Melton. They're going to say this is not just a little chip fracture. This is a more worrisome injury, and then you'll get the right. Like even if you went to one of the other providers, whether it's a physician assistant or a general orthopedic surgeon like myself, we're going to say this is a nothing burger, or it's something more serious that needs evaluated by a more highly trained specialist.
As you suggested, in the world of turf toe injuries, we'll talk about that specifically. If you have a grade 1 injury, it's not likely that a general orthopod is refer that out. They're going to be more than prepared to assess that, diagnose that, and manage that very reasonably. Even some more complex grade 2 injuries, if they suspect a grade 3 injury, that's likely coming to Dr. Melton or I.
Okay.
That's because again, in the world of orthopedics, it's guys like us that are guys and gals like us that are tackling those types of injuries.
Yeah, and really, if this is a global podcast, so you can Google or do a search for foot and ankle specialist near me. And if you're in Frankfurt, Germany, and kudos to them because more of them listen than people in Chicago.
The International Foot and Ankle Society has a website. The American Orthopedic Foot and Ankle Society has a website. You can do a search on there for subspecialists in that discipline specifically. And so members of the AOFAS here domestically will be listed on that website and referenced based upon your geographic location. So if you need somebody, that's a great resource.
All right. Well, I want to thank you. What a timely conversation, right? When we heard about the injury and you called up, said, let's do this, we're putting this podcast out tonight if I can get it done. Because this people like me who their whole happiness is based upon Sunday games, right? This is important.
Well, I think Browning did a heck of a job cleaning up on Sunday. The team did great, and again, I think Joe is going to be in great hands, and we can hope he's back sooner than we anticipate. But I think it's just really important to understand the severity of this injury and what he and his team are going to be navigating here during his recovery. So.
All right. Well, thank you very much, Joe. Get better quick. We don't rush it though. Just get better.
And let's thank Terry at Tri-Level Recordings for doing a great job.
Let's thank Terry.
Thank you, sir.
Thank you, Terry.
Thanks, Dr. Urse.
All right, guys. Thanks again. Bye.